We've had strong community support for our mental health programs in our schools. However, there's been some questions around CYBHI and a change in the way schools are possibly funding some of the mental health services. So we've had to do some outreach and we've had to have some conversations. Some of the things that we've been assuring our community about, A, is the ability to opt in and opt out. Parents always have that ability to opt in and opt out, and we always want to have that positive parent relationship. Now, I'd love to have a conversation with them and what CYBHI can do for our schools and their particular student. However, you know, if they really want to opt out, that's okay. We're sitting in the Silver Springs Wellness Center. This was our first wellness center that was created in our campus about 5 years ago. We'd had some background in Medi-Cal billing, but I felt when we first had that come out, I felt like we really fit the mold for this because we had a lot of it already in place. So we jumped on into the first cohort in the fall of 2004 or 3, and really all through 2004, we've really worked towards where we are today. One of our big pieces was early on, because we already had the infrastructure in place for the billing, we had to really figure out a way that we were going to grab the data and make sure that we had the support to bill. So the Wellness Center started to become a real conduit to bring students in and to start the idea of tracking student data. And we've been doing that for a while. So we were able to transition that into the program and really hit the ground running with taking the data on the students. And STARS, our general mental health, had already been taking data. So that accelerated us to actually having students data in the system, getting the mental health services they need. What we realized is we were right there when it opened up and we put it in. So we were lucky enough and to be the first to successfully submit a service or for billing, and we actually got our first check, and so that was pretty special. You know, people would look at it and be like, it's only $77, but if you really look back to the year and a half of work that was a really big milestone for us. Additionally, one of the things that we always focus on is that we are school-based counseling. We have a referral process. We partner with a company called Care Solace to refer out if the students are needing more than just school-based therapy, but things that they can use right away in a classroom to bring anxiety down, to help them deal with depression. Deep, dark clinical work needs to happen outside of the school setting, and we want to support that as well. And we'll walk with a student to do that with a warm handoff through our Care Solace into another provider. But parents are often worried, like, what are we doing and why are we in this space? We're in this space so our students feel safe at school and can get back to the classroom and learn at high levels.